Hi, everybody. This is Mary.
And I'm Amy.
We're the full-time clinic nurses, and we're here today doing a just-in-time video instruction on everything you need to know about discharging your patient from the burn ICU. Who do we see in clinic after discharge? We see every single patient after discharge, at least once, and sometimes for weeks or months. We're going to see patients in person. We're also going to see some of our patients virtually using the MyChart platform. And we also follow up on all of our patients who are discharged to skilled nursing facilities and to long-term acute care centers.
When does discharge begin? It begins at admission. We really want to empower the bedside nurses to start thinking about that pretty much when the patient is arriving. A lot of our patients are from out of state, so it's important to sort of start thinking about that right away. Some of the bullet points we go over with the patient at discharge is, are they eating and drinking okay? Are you able to take in adequate hydration by mouth? Are you okay with pain meds by mouth and not IV? How is your wound? Is it stable and healing on the healing train or not? And do you have a safe place to go with running water once you discharge? One of the things we also like to go over is, does a patient need to be weaned off pain medication, and what that looks like post-op, or not post-op, but discharge? Is the wound stable? Has anybody come in to learn your wound care? And if the patient has home health orders, just to remember that home health is only 3 days a week. So that's 4 days a week that somebody either needs to help them do their wound care, or the patient needs to be able to do it on their own.
We want you to know what the plan is for follow-up. So it's important that you know when the appointment has been scheduled for their discharge appointment, and that you give them adequate supplies to last until that first clinic appointment. Equally as important is if you know they're going to have a virtual visit for their first follow-up appointment, they're not coming back to clinic. So you need to supply them with an extra week of supplies and always give them a few extra. Bottom line here is never discharge a patient without adequate supplies. There's also a controlled substance agreement. We call it the CSA, or medication agreement. This is a required agreement that the patient needs to fill out, acknowledge, and sign that goes into their permanent chart. The PAs are going to require this be filled out before the patient is discharged for every single patient who's going home with narcotics.
MyChart, it's a huge go-to for us. With every patient that discharges, we would like to have them active in MyChart. That's both pediatric patients and adult patients. We depend on it because most of our patients are from out of state or they're from further away. And the ability for them to send us photos is really important for their wound healing and progression, so they don't have to drive all the way back here to see us in clinic. Also, all of our virtual visits that are in home are run through the MyChart app. So it's really important that they have that prior to their discharge so that they can go over how to run a visit, if there's any concerns, and we can go over them before they discharge. Also, all pediatric patients, like we said, we would like to have a MyChart account with. That means we need to get proxy access with their parent. So if you have a pediatric patient that you know is discharging within the next couple of days, if you don't mind looking and seeing if they have MyChart access. If they don't, let Mary and I know, and we will go and meet with the family and get that started.
Here are a few additional resources for you to access. The Nursing Bedside Manual lists the discharge criteria that Amy reviewed. The Burn Care Guide video was produced last spring. Lisa introduces the bedside burn care guide that all patients can be given on the day that they're admitted. We also have an outpatient clinic burn care guide that we're giving out now. And there's a discharge learning unit. I think this is one of the required learning units that you need to complete during your nursing orientation with burn. Lastly, let us know if your discharge plans for the patient is changing. We all know that we have a set discharge date, and then that changes as things come up. So if there's any questions about when their follow-up appointment is scheduled, or changes between bedside patient rounds and the morning board rounds, please come in and find us in the clinic. We're here to help and support you.
Thank you very much.
Thanks, guys.
Bye.